Hello everyone, I'm Mrs. Rowena Aguilar Laughlin, the Provincial Director of Mutia Pilipinas, Pampanga. Why I am here today and where I'm at now today, I'm here at CSA Medical Aesthetics Clinic to do a non-surgical procedure for my face because at my age, I'm not getting any younger anymore. I think I needed some help to make my face look younger and more beautiful. And Dr. Contessa will help me to improve my face. And today, hopefully, there will be no downtime and I can get that beautiful and younger looking face after the procedure. Thank you. And don't forget to click the subscribe button and notification bell to keep you updated.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a new guest, but she's no longer new with CSA. She's been with us for quite a while already. Guest, let's welcome Ma'am Rowena Laughlin.
Hello, hi everyone.
Yeah. So Ma'am Weng had been with, okay, I'll call Ma'am Rowena Ma'am Weng. I'm used to calling her Weng. She's been with CSA for like several years, right?
Several years,
yeah.
yes.
And knowing Weng, she has some histories of skin sensitivities, allergies, and we've taken good care of that. Because some of our patients are asking me, Doc, if I have this like allergies, can I still do some aesthetic procedures? That's also a good topic, right?
Yes.
Yeah, because some people are reacting to certain like topical creams, skincare creams, and then all of a sudden they have these rashes on their face.
Especially me, Doc. I'm too sensitive. My skin is too sensitive with the chemicals, you know.
Yeah, because with her before, I was seeing her skin having redness, irritations, some of those tiny papules, itchiness, or like swelling. And it's kind of annoying that you have this skin irritations.
Thank God now. You look at my face. Thank you, Doc.
Yeah. So, and then after that, when we had controlled your skin sensitivities, we already did some injections of, for example, Botox to get rid of lines and wrinkles. We've also done some fillers for the nasolabial fold to kind of rejuvenate the face, right?
Yes, and I'm happy.
Yes, that's a good thing. Of course, even if we have like skin allergies, skin sensitivities, as long as we control those skin conditions, we can still do aesthetic medical treatments as long as you go to your certified aesthetic doctors. For now, with Ma'am Weng, because I'm checking on her face, mid-face, and lower face, that's the main concern right now. Because the middle face area, as time passes by, we're gonna see some of the sagginess here, or the drooping, the so-called ptosis in our medical term, because of the weakening of some of the ligaments here, and you know, some of the volume tissues there tend to go down. This is the so-called the descent, or the going down of the tissues. So parang, Ma'am Weng, umano na, bumababa na.
Yes, at my age, Doc, siyempre.
How young are you?
Actually, I'm
in 40s?
55.
Oh, okay. 50s.
Next month. So, you know, I need help.
I thought 45.
Oh, thank you.
So, with the mid-face section, you will start to see, of course, with the pull of gravity, tissues there tend to go down. With the weakening of the, for example, the muscle weakening, the ligament weakening, and some of the fat compartments there, they tend to go down. And then, going to the lower third of the face, we start to see jowls here. And then causing the jawline not so defined anymore, or some irregularities in that line there in the mandibular line. And you'll start to see nasolabial fold, marionette lines. So what we want to treat for Ma'am Weng right now is this sagginess here, mid-face, and sagginess here, lower face. Of course, we'll do a non-surgical method.
Yes.
We'll be doing something not so much of a very, very invasive or the surgical thing that's so drastic. Because Ma'am Weng is so busy. So we wanted a procedure that somehow
Yes.
minimal downtime, or she can still do her, your activities, your responsibilities with what you have right now.
Yes.
Okay, so what kind of treatment, what kind of procedure, we'll show you when CSA Medical Aesthetics return. And we're back. So what we're doing for Ma'am Rowena is a so-called non-surgical cog lifting technique or cog thread lift. Okay,
That's the
because
cog thread.
yes, we
Kasi
wanted
they asked
to.
me, syempre,
Yeah.
I will say that.
Right. So, because as time passes by, the tissues on the upper area, they tend to go down or they descend. Yun yung masakit na katotohanan, Rowena. Yeah, because of the pull of gravity and those weakening of those tissues inside, even the collagen is going or getting depleted, and even the elastin and other supporting structures. So for Ma'am Weng, we wanted to do a lifting mid-face as well as lower face. So we wanted to also improve the nasolabial fold as well as the marionette line here. So when we use our cog thread lift, of course, it's significant for, especially for doctors performing this, to master the anatomy of the face. The different layers, where do we place the threads? So for now, we'll be using the so-called, these are cog threads, thicker type of threads. They're not the same as those mono-smooth threads, because we have some thread materials that are just a plain, simple, single strand, and the thread is very thin. So they have thickness. So we call this, like for example, I have a 4-0 thread, a 6-0 thread, or a 2-0 thread. So iba-iba yon, Ma'am Weng. Merong classification yung mga types of threads that we're using. Yes. And we also have the so-called polydioxanone threads. We have polycaprolactone threads. We have also the polyelactic threads. So we have different kinds of threads. So for now, we'll be using the polydioxanone type of our threads. Okay, I have a specific kind of thread here. It's more of a molding cog thread. So actually, it's a different kind of thread as compared to the other threads I've used in the past. You notice they have like a spike or like thorns in a strand. Okay, but this one, molding is different. So it's kind of embossed on the thread itself. So it's a thick kind of a thread, and the structure in the thread, it's different as to the other cog type. So we call this embossed molding type. So it has a certain name, a molded type of a cog thread. So it's not same as the other cog threads. So with these kinds of threads, they still vary in terms of their appearances or the type of, like, is it the barb, then, or is it the molding or the embossed? We also use in the past and fixed types of threads. They have a different kind of structural appearance on the strand of the thread. So for now, we'll be using this molded cog thread for Ma'am Weng. So that's gonna give also a stronger pull, because those strands there, those hooks or those embossed type of strands there, they're like the ones grasping those tissues that had sagged down. Yung mga nahulog na, Ma'am Weng, yung mga bumagsak, there you go. So we wanted to hold them and bring them back upwards. It's like just repositioning again. So if it went down to the lower part of the face, we wanted to bring them back upwards. Make sense, Ma'am Weng?
Yes.
However, as we grasp the soft tissues, it's normal that in the surface layer, you may notice some like a pulling effect inwards. Kasi yung iba naming patients, they were wondering, bakit ako nagkaroon ng irregularity, nagkaroon ng dents? Because you have in your strand hooks or barbs or those cogs or those like molding, because they grasp the soft tissues. And of course, your soft tissue is connected to the skin. That's why you'll have, like, for example, pwedeng they say it's like a dent or it's like a dimpling. That will be expected. However, for the doctors performing this, we don't want to have too much of the dents.
Right.
Pag naman, if you don't have naman that some dents there, walang effect yung repositioning of those saggy tissues. So for now, so they cleanse the skin, and then we can spray some topical lidocaine cream. Let's show them. Turn to the left side, Ma'am Weng. So they will spray the topical lidocaine spray. Okay. So this is also a type of topical that you can apply on your patient before doing the procedure, and then cover. There you go. And then we can anesthetize the track of our thread. For example, if you want to do your lifting on your mid-face section or nasolabial lift, for now what I will do is I'll separate the entry points. I'll make 3 separate entry points for my upper mid-face area here. Okay, just the entry point there, lidocaine. So my layer here, actually my landmark here is the lateral canthus. I make a horizontal line like that, and that's my first entry point. And then I want to numb the area here. I can do an infraorbital nerve block here for Ma'am Weng. Inhale, exhale lang po. Actually, Ma'am Weng has a good volume already. She has a good tissue volume. For my patients who have adequate mid-face volume, I really don't recommend the dermal filler anymore, because it's gonna add weight to that tissue. So some patients will have more of a, or too much of a volume on the face, and we do not want that over, you know, too much of a cheek, right, Ma'am Weng? So we just want to have a balanced, proportioned mid-face area. So there you go, that's my lidocaine. And for my first molding cog, so this is my entry point. So I now have here, so it's a thick kind of a cog thread. So it's already loaded inside the cannula here. Now the cannula is also thick. For doctors doing this, it's significant that you also assess the tissue coverage. If your patient has thicker tissue coverage, you can use a bigger gauge cannula. If you notice they have a thinner tissue coverage, use a smaller gauge cannula also. So ideally, when we do cog, the goal is to reach the so-called mass layer. So this is to just glide your cannula towards your nasolabial fold. So I'm just gently pushing. Okay, Ma'am Weng has a good tolerance. Okay.
Yes, I've been
yeah, injections also.
Yes.
So I want to reach this nasolabial fold here, and I'm already in the malar section. And I wanted to correct that Indian line or Indian groove there. So we also want to lift the so-called malar tissues. Okay, so I'll be reaching up to the nasolabial area. Now have your assistant pull the skin like a counter traction there. So you want to reach that fold, gentle approach. Okay. Then once you have reached that end point there, then you can pull out your cannula already. So we're inserting our second molded cog thread here. So my entry point, another entry point for that one. And I have here my cog thread here. And then I'm gonna direct again into that nasolabial area there. So my vector is like a horizontal type of a vector here. So you can do like a vertical or a horizontal type of vector depending on what are you trying to pull or lift. Okay, inhale, exhale, Ma'am Weng. Okay, I know it's kind of, I'm in a mass layer here. I wanted to target those soft tissues and bring them back to that original higher position there. So we wanted to do
that one. I don't feel it. You
okay,
insert
good.
something?
Yes.
Oh, okay.
So I'm very gentle. I just want to be slowly. And we want to reach that nasolabial line there. And I'm going to be pulling out my second cog here. There we go. As you notice, the threads are thicker. And let's do the third one. Entry point, please.
That's cool. So that's how.
Yeah. So I'm on my third cog there. Okay, so I am proceeding to the third cog thread here and inserting into that entry point towards our nasolabial fold there. And we just direct it downwards medially. And after this, we'll do the lower third of the face where we want to do a marionette lifting. So as you can notice, I'm also near the corner of the mouth, so we can do a lifting of the corner of the mouth there. Then next, I'll proceed to the lower third. I'll be doing the 3 injection again here. So entry point. Now you can have like a 2 to 3 centimeters like from your tragus here as your distance, so you can avoid your superficial temporal artery here, which is a branch of your external carotid artery. So we'll proceed with this side here and then glide towards our marionette line right now. So I am directing to the marionette line already. So it's kind of some resistance there. Sometimes there are fibrotic tissues there, and it's helping us also release the fibrotic tissues. It's called subcision already. So this is also good for those people with severe acne scars. If they want to do subcision or releasing of those fibrotic bands, then this is very beneficial for them. So I can reach the marionette line here and then pull out. And then my next one is here. So I'm using 6 cog threads for Mamweng on this side here. And considering the right side has more of a sagginess than the left, so we'll just proceed with this part here up to that marionette line. If we also want to do jawline definition, cog lifting is also a good treatment. If you want to lift the saggy tissues in the jawline area, then this is also a good method to improve that and correct that. So this is my last part for my right side of our face. Okay, so I'm in this mask layer, which is a layer 3, a safe layer for your cog threads to be inserted. In some areas, we also use the subcutaneous layer for our cog lifting. So we'll just be cutting the remnants of our threads, and one at a time you can cut, then just cut and just cut. So there you go. So we are now proceeding to the left side. So for our first cog thread here, the goal is to do a nasolabial lifting for the mid-face section. So this is my first cog thread towards that. Cut there, and cut there, and cut there. So we're done with our cog lifting. We'll show the result to Ma'am Weng when CSA Medical Aesthetics return. And we're back. We'll now show the result to Ma'am Weng. Here's the mirror.
Mirror, mirror on the wall.
There you
Oh,
go.
wow.
Yeah.
Oh, that's nice, Doc.
Right. So there's a noticeable lifting result.
Yes.
So the nasolabial
instant.
fold, yes, and marionette line, there's already this lifting effect. And I can really visualize the improvement. So also here, the mid-face, it's less of too much of the projection. And I can notice already the jowl, it's being reduced. And it's not yet the final outcome, because over time, like the 12 weeks time, there's still this neocollagenesis and further stimulation of tissues inside. You'll see more result from this PDO cog thread lifting.
Thank you, Doctora.
Yes.
My goodness. This
So
is
how's the
nice.
experience, Ma'am Weng?
You know, the anesthesia
Yeah.
is the only pain that I felt, but
Yeah,
the procedure
understandable.
itself, I can't even feel anything. when
Right.
you
It
put
was
the
really
thread.
numb when we were
Yes.
doing or inserting those cog threads.
So how
right?
long is the effect of this, Doc?
Which one? The anesthesia? Well, the cog threads, okay, PDO, they hydrolyze in 12 months' time. But what we're still seeing there is this development of collagen networks around those fibrous threads.
Okay.
So over time, you'll still see some lifting there. Now,
Okay.
some of our patients doing cog thread lifting, they may repeat in a year or two. Of course, depending on the
Depends
need.
on-
Depending on the need, also depending on the lifestyle of the person, depending on our metabolism, and depending on how severe the sagginess is, and also the age of the individual. Of course, the younger you start, of course, the next treatment will be a longer time. But of course, if like we have like an older age and we really have that severe sagginess, we need more treatments for this. That's why I tell my patients, like, if you're in your 40s or even before 40s already, you can start
Yes.
doing these kinds of procedures for prevention. And we've seen patients, like, they're in their 40s and they've done it. And then really over time, because of they still have that good dermal fibroblast formation of collagen, it's like the aging process is like you stop it, you halt it, and actually they're noticing that they're becoming younger and younger as days pass by. So that's the wonderful thing with this non-surgical method, with these kinds of product materials that we have right now. And we are still improving the materials that we have, the techniques that we do. We're further improving it. We're still like giving more of an improved outcome for everyone. And of course, the safety. The safety of the treatment is always a priority. So we do not do harm for anybody here. Okay. And the others are worried about like the pain. Doc, is it painful? It looks painful.
No.
It's just the anesthesia injection, right?
Yes.
Yeah. But it's
the anesthesia.
tolerable.
It's tolerable. And syempre,
Yeah.
taste ganda.
Right.
And then one good thing about it is I can do my usual activity
Yeah.
after this,
You
right?
still have like a
I can
meeting
even-
or
all what I thought, like after the procedure, like I cannot eat or I can
Yeah.
like barely move or
Yeah.
smile, but no, it's
Yeah.
not. It's
Yeah.
it's just like everything.
and there's an instant result already for Ma'am Weng.
Yes.
That's a wonderful thing there. So other than that, we tell our patients also after the procedure, of course, we tell them to eat soft diet first. Okay, as much as possible, avoid too much of movement around the mouth
The
area
chewing, the chewing.
to prevent some discomfort there. And we give prophylaxis antibacterial and also some analgesics there, and do cold compress
How
after
about
the treatment.
washing
Yeah.
my face?
Yeah, you can do not
Good,
hot
good.
water, but
Not
basta
hot water, okay.
cold lang from the faucet.
Oh, okay.
Okay. And then also, sometimes we tell our patients avoid type of food na allergogenic. Okay.
Okay.
Those ones. Just to prevent any swelling there and any counter reactions there. And considering Ma'am Weng kasi has history of allergies.
Yes.
So there are some food that you have to avoid too. Right? That's it. Then we check again, like after 2 weeks, 4 weeks, we'll still see more improvements of what we've done today. Thank you, Ma'am Weng.
Thank you also. Thank you, Doctora.
See you again.
And your assistant.
Right. Also,
Yes.
Ma'am Sandra,
Yes,
the
love of my life also.
yeah, smart and
So,
intelligent assistant.
Thank you, CSA.
Thank you.
And
We'll
hope to
see
see you again soon.
Right. Thank you so much. If you have any questions, you may email us at csaskinclinic@yahoo.gov, FB page, CSA Medical Aesthetics, also our Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. Please do watch our other video episodes. Just look at our channel, Contessa Salvador, and please click the subscribe button and notification bell. Ma'am Weng, do you have any like Instagram or any social media account that they can reach you so that if they like want to ask questions regarding the procedure?
Yes,
About
you
your
can.
experience.
Yes. Of course, on my Facebook account, Wen
Yeah.
Laughlin. You can also
Right.
now, since I'm in
Oh, yeah.
pageantry, right?
Pageantry, right.
Mutia Pilipinas, Pampanga.
Yes.
So you can also watch because eventually I will gonna post this dog.
Right, yeah, please do watch that.
Yes,
Okay, thank you so much. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.